name is Sarah Knutson, and I am the medical planning director for the incident command team for the hospital's response to the COVID pandemic. So we did have an additional question from Jerry, and I want to reach out to her with a special answer here. And a lot of people have had this question.
When will I get my vaccine, considering my age and compromised health?
This has to do with prioritization of the vaccine, which is all we know is it's a supply that is going to be exceeded by demand. It's very important up front to prioritize how these vaccines are administered in terms of order of timeliness, with the idea being that we want to get everyone vaccinated just as rapidly as we can. So Colorado has been, I think, very forward-leaning in this regard in terms of ethical prioritization of a limited supplied vaccine. And what they've come up with is a balanced equation, I think, that brings into question, on one hand, the likelihood and risk of infection of potentially essential personnel that are needed for function of both medical care, safeguards in society, fire, police, things of that nature, and then recognizing that there's an extraordinarily increased risk of mortality in course of severe illness for people with predisposing conditions, as well as those who are elderly, and especially greater than 70 and even more so greater than 80. And so the order of prioritization takes into account really those two things, which aren't the same, but they are being made to reconcile with each other. And so with respect to Colorado, the plan that was devised was upfront in a phased sort of a manner to deliver vaccine as it became available. Early on, the most priority was felt to be into clinical healthcare providers, so people that had a high risk of encountering COVID-related illness. And those same individuals are in relatively shorter supply and have a high risk related to their profession. The groups following that are probably the first responders, and in that group, it would include police, fire, detention, prison-type staff, as well as any emergency medical support type individuals. And following that group is probably going to be the group that starts to evolve into people that are in high-density congregate living, or by way of their occupation, such as teachers, grocery store clerks, people of that nature, have frequent and multiple contact with a large number of individuals. So again, an increased risk for infection. And then right in there behind that is an elderly person. I believe the age cutoff is greater than 65, certainly 75 is even more high risk. And then has a disease of risk for increased severity of disease. So diabetes, any sort of primary lung disease, COPD, pulmonary fibrosis, immunocompromised status, obesity, even hypertension. But with the organization and just setting to the task, I think it can be accomplished in an orderly way. And it's going to be accomplished at a variety of sites, and that all those details are still to be worked out, basically. But hopefully that can all be accomplished by the spring. And then the vaccine sort of timeline looks towards the summer for the regular person with no, significant increased morbidity or mortality. So the 18 to 64-year-old person that doesn't have any sort of increased risk factor. Like with any medical procedure or medication, it's always recommended that you speak with your primary care doctor to answer any of your questions that you might have, or any special considerations that might apply to you as a patient.